At the Obafemi Awolowo Teaching Hospital complex in Osun State, members of the National Union of Allied Health Professionals stage a protest. They say their demands have not changed since last year.
Between now and 29th of May, I'm appealing to Mr. President to ensure that he fulfills the promise which he made to the joint health sector unions. More so that the issue at stake are the issues of agreements already mutually signed between the two parties. The issues of court judgments already entered in our favor. The issue of salary adjustment that was agreed between the two parties in March last year. And the issue of discrimination against us in the health sector.
The Lagos University Teaching Hospital, Idi-Araba, has some activity, even though the atmosphere seems a bit subdued. Here at the Federal Neuropsychiatric Hospital, Yaba, activities in the X-ray unit and the psychology department appear to have ground to a halt. This lady, who is employed in the medical laboratory unit, describes what it has been like since the strike began.
The last time we had active work was on Monday, and the patient that came in that were properly registered, they are 29. And since then, it has been like 6, 8, but like today, none, because there's nothing going on. We are just here because the Congress asked us to come for meeting. That's why we are here.
But there is something else the striking health workers would like the federal government to take note of.
It has become a policy that we don't know why the government is pulling such policy through the Federal Ministry of Health. We don't know how true it is, but what we are saying is that our department should not be given to the private sector to run. If it's given to the private sector to run, definitely we know that capacity development will not improve. We also know that if that is given out, a lot of people will suffer, the masses will suffer.
This building behind me was commissioned late last year by the Honorable Minister of Health, Dr. Khaliru Al-Hassan. Now, one of the agitations of the striking health workers is that services here should not be privatized. They believe that privatization will give jobs to outsiders, depriving deserving professionals of jobs within the institution. Mary Alale Yusuf, Channels Television News.